My name is Gopalakrishnan. I'm an infectious disease physician, and I'd just like to address a couple of issues about this new mutant virus, the form of COVID-19 you might have heard of, that's been quite a lot in the news recently. Now, we know that this virus is probably more communicable, but what about other aspects? Is it going to cause more severe disease? Is it going to be resistant to the antiviral treatments that we have today? And most importantly, will vaccines work against this virus, against this new mutant virus? Now, we don't know the answers exactly for each of these questions, but most people think that the 2 to 3 mutations that you have in this virus are not going to change treatment aspects, severity aspects, or vaccine immunity aspects. Since the medications we use for COVID, the mutant in the spike protein mutation may not affect the efficacy of antivirals. Similarly, there's no reason to believe that disease will be more severe. We know that if you have COVID, roughly your chance of death is certainly less than 1%. And we don't think that that number will change because of this mutation. So people need not worry that they will have more severe disease because of this virus. Finally, what about vaccines? The vaccines we have currently available that are licensed for use, the so-called mRNA vaccines, actually work against many epitopes on that spike protein area. So it's not just the mutated area against which these vaccines work, it works against several non-mutated areas as well. So people think that vaccine-induced immunity will eliminate the mutant virus as well. So as far as we know today, yes, it's a concern, especially for people who come from the UK. It may take hold in India. We don't know whether it will replace or cause a second wave. Certainly, it's probably more transmissible than the conventional SARS-CoV-2 virus, but don't worry about getting sicker. Don't worry that the medicines won't work. Certainly, continue to get vaccinated as and when vaccine comes to India. But it reinforces what we have always said about COVID. Masking, social distancing at least 2 meters away, avoidance of crowded indoor places, and hand hygiene. This is going to be even more critical in order to prevent this new vaccine, this new variant from taking root and spreading within India. Thank you.